A major setback for President Trump's health agenda. Just a few minutes ago, a federal judge in Boston blocked the administration from limiting COVID shots and changing the childhood vaccine schedule.
Among his reasons, those decisions were not based on science. Joining us now is Dr. Scott Hadland, who's chief of adolescent medicine at Mass General Brigham for children. Dr. Hadland, thanks for your time.
Thanks for having me.
Thanks for being here. So Judge Brian Murphy issued this ruling in response to a lawsuit brought by several prominent medical groups, including the American Academy of Pediatrics. What is your reaction to this?
Well, I think that this is good for kids. You know, what the judge has told us is that if there are going to be changes to the national vaccine schedule, there has to be a rigorous scientific vetting process that underlies it. Just to remind viewers what happened last year, Health and Human Services Secretary Robert F. Kennedy Jr. actually fired all of the members of the CDC's Advisory Committee on Immunization Practices and replaced them with a majority of individuals who were actually skeptical of vaccines. And many of these individuals actually didn't have the expertise or experience to be able to make decisions about vaccines. This group then went on to make major changes to the vaccine schedule for everybody, but in particular for kids, including babies, for some, very serious conditions, for example, like hepatitis B. And so what this judge's ruling does today actually is puts the brake on this process and says, look, we're going to abide by the previous vaccine schedule, which was science-driven.
So how will this decision affect families here in Massachusetts, if at all? We know the state had rejected some of this new schedule, this new guidance.
Yeah, Governor Healy and also our public health commissioner, Dr. Robbie Goldstein, have been very proactive in the Commonwealth about making sure that as the CDC has changed its immunization schedule and again gone contrary to the science when they've done that, that actually here in Massachusetts the recommendation has been actually to follow the American Academy of Pediatrics vaccine schedule. This vaccine schedule used to be in close alignment with the CDC's vaccine schedule, is very scientifically driven, scientifically based, and so physicians here in Massachusetts have largely actually been adhering to a vaccine schedule that is driven by science. So there may not be huge changes here, but I think this will help clear the air for a lot of families who may have been confused about these conflicting messages.
Yeah, as we know, this has kind of been politicized, so more parents, they've been saying no to certain vaccines. Do you think this ruling could change any minds?
Well, it is true that there is a rising amount of vaccine skepticism here in the U.S., but it is worth noting that the vast majority of Americans actually know and understand that vaccines are, they keep people healthy, they're effective, and they are safe. In fact, more than 8 out of 10 Americans know this to be true. And so I think that actually this messaging is important, not necessarily to convince folks who may be skeptical of vaccines, but actually just to clear the air and make it very clear that the vaccine schedule that we use here in the U.S. is scientifically driven. And I would just encourage folks, if you have questions about vaccines, please talk to your primary care doctor. In fact, a survey that came out last week showed that more than 8 out of 10 Americans trust their primary care doctor more than anybody else on these questions. And so I'd encourage folks to dig into that and bring us your questions. It's what we're here for.
Dr. Scott Hadland with Mass General Brigham. We appreciate your expertise. Thanks very much.
Thank you.